Even though diet and weight loss are important components of improving cholesterol level, they are not often enough in many patients who are at very high risk of heart disease or stroke. These are people who have had previous episodes of heart attack or coronary artery disease, or who are at very high risk such as uncontrolled diabetes or high blood pressure or history of smoking. So the bottom line is that diet is a very important component of cholesterol reduction, but in many patients a medication would be required. We in fact have new guidelines which were released by the American Heart Association and American College of Cardiology last year, reminding us that in many patients who are at high risk of heart disease or stroke, we are not lowering cholesterol enough. And there's a lot of evidence that if we lower the cholesterol enough, we can prevent the progression of heart disease, we can prevent new heart attacks, or we can prevent the first heart attack by lowering cholesterol. And in order to do that, we have some very effective medications, a class of medication that is called statins. Statins are very useful drugs. They have been available now for almost 35 years. They lower cholesterol very effectively in most cases, and it has been shown in many clinical trials that they actually reduce the risk of heart disease quite substantially. And we have seen over the past few decades that the mortality and morbidity from heart disease has gone down because of the use of these drugs that are available. Fortunately, there are 7 different drugs in the statin class, out of which 5 are generic, which means that they are relatively inexpensive, and oftentimes they are used only once a day. And therefore, the availability of these generically available statins has actually improved the possibility of their use without incurring extra cost on the part of many patients. Many patients who have diabetes, which is not in good control, they might say, well, I'll improve my blood sugar control and that will lower my cholesterol. That may be true, but it's a very moderate measure in lowering cholesterol. Lowering blood sugar is very important for reducing the risk of eye disease and kidney disease and neuropathy. But lowering blood sugar or improving blood sugar control may not get your cholesterol to the level that you want it to be. So in other words, it has a very modest effect on lowering LDL cholesterol, which is the main atherogenic factor that we are after. Absolutely. This is a common myth. Some people feel that my HDL or the good cholesterol is high or above average, so why should I worry about my LDL cholesterol or the bad cholesterol? We have known from many clinical trials now that even people with high HDL cholesterol, unless you lower LDL cholesterol, their risk still remains high. In fact, in people with low HDL cholesterol, the same applies, that you need to lower LDL cholesterol and then worry about the low HDL cholesterol. And therefore, just because having HDL cholesterol in the high range, one should not be complacent about the value of lowering LDL cholesterol.